Hello folks. In this video I want to review the bone markings of the pelvis or the pelvic girdle, which consists of the three bones, the ilium, ischium, and pubis, and the bone markings of the femur, the tibia, the fibula, and then a couple on uh, the tarsals or the bones that make up the ankle. Okay, so we're going to start with the pelvis first, and I'm going to show you two views here just to give you a sense of where some of these bone markings are. This is showing you the right pelvis. So this would be if someone were staring and looking at you, right? So this was the front of their pelvis. This is the pubic symphysis. This is the back of their pelvis here, right? So this is that same view, except now we've got both sides, right and left side, and we've got the sacrum inserted in there as well. So there's a couple things to see here. First, that we don't see in the other image. There's this little plug of fibrocartilage here. This is the pubic symphysis. And then there's where the sacrum articulates with the ilium on either side, right? Now you can't see that here. That's our surface. It's called the auricular surface, right? Auricle means ear, and I suppose if we flip back here, it's a vaguely ear-shaped kind of an area here, and the auricular surface is right here. I'm outlining it. So this is where the sacrum articulates with the ilium. That's the auricular surface. Oops. Okay, so let's look at some landmarks now on this. First, the three bones are maybe kind of easiest to distinguish by uh, sort of general location. Up here, this is the ilium. Now, all these bones meet and fuse at synostoses. They're right within the acetabulum. So this is the acetabulum. This is the socket that holds the ball of the femur, right, in that ball and socket joint. So the ilium is basically all of this, and then kind of intersects here in the middle. Then we have this rear bone, the ischium, right, which kind of goes like this. And then we have the more interior bone, the pubis, which is all along this arm, the pubic symphysis, and back to about the middle of this arm here. So ilium, ischium, pubis. Now let's look at the ilium. This is a pretty good example of these spines that I want to show you. So there's the anterior superior iliac spine, and this is the anterior superior iliac spine. We'll abbreviate that as ASIS. And then there's the posterior superior iliac spine. So this is and it's easy to see in this. This is actually a pelvis from a male, and so this spine is pretty easy to see. And then here is the posterior inferior, because it's below, right? Posterior inferior iliac spine, and here uh, it's not very prominent, but it's the anterior inferior iliac spine. If we look at this other pelvis, we can kind of see that. This is a female pelvis. So the anterior superior, here's the anterior inferior, here's the posterior superior, and the posterior inferior. It's difficult to really see on this female pelvis because of the way it's shaped. It's not super clear, but they're close together. So the posterior superior and the posterior inferior are quite close on this. Okay. I would give you, if I wanted you to differentiate between those, I would give you a male pelvis, I think. So then we have the iliac fossa, right? That's this big, broad, scooped out section here, the iliac fossa. We do have some pretty big hip flexor muscle insertions here. So the iliac fossa, if we jump back over here, right, this is our iliac fossa. There's our iliac fossa. We have our ischial tuberosity and ischial spine. Now we've got to go back to the ischium to see those. This is the ischial spine. It's quite prominent, right? It's a big bony protuberance with muscle attachments. And here is the ischial tuberosity right here. It's just flared out, roughened section of the ischium. This is basically what you think of as your sits bones. We might be able to see, yeah, it's prominently roughened right in there, right? So this is all ischial tuberosity. We can see that too pretty well on this one. The ischial spine is really obvious, and the ischial spine and the ischial tuberosity right here, right? The ischial tuberosity. And we can see that on this side, ischial tuberosity, and here. Okay. We often talk about the ramus of the pubis. This is the ramus of the pubis here. This is also called a ramus, the arm, right? So this is the ramus of the pubis here. This is also sometimes called the ramus, but it really consists of both pubis and ischium. The obturator foramen is this very large foramen here, right, through which nerves and blood vessels pass, the obturator foramen. The pubic symphysis, you can see here's this little fibrocartilage plug here, right, which is this synchondrosis separates the pubis of one side from pubis of the other at this fibrocartilage plate, the pubic symphysis. And then we have the we've talked about the acetabulum, right? This is that scooped out region that accepts the head of the femur. And then the pelvic brim is this area right here. It's basically where the angle of the ischium and the ilium really changes, and this is the this is the kind of the brim of this bowl shaped structure that is the pelvis, right? So that's the pelvic brim. Okay, let's go to the femur. So here's our femur. This is let's see, so this is it's tilted a little bit of a weird direction, yeah. But let's see if I can, what happens if I try to do this full screen? It might work. Yeah, this is a posterior view. So this is the posterior part of this femur. So in as much as this ball is fitting into that socket, I know that medial must be in this direction. And so this has got to be my left femur. So there's the head of the femur. There's the neck of the femur. We've got some prominent bone markings. This huge greater trochanter, this smaller lesser trochanter, where we have muscle attachments. You can see this from the other side, the greater trochanter. This is on the front side now, the greater trochanter. And then where's that lesser? There it is, that lesser trochanter there. Okay. We've also got the gluteal tuberosity, which we can find right about there. So this roughened region here that's standing up, that's the gluteal tuberosity, right? So it's on the posterior side, just below, kind of lateral to, and just below the lesser trochanter. We've got the linea aspera. We've got a number of adductor muscles and some extensor muscles that insert along this roughened ridge here. The linea aspera, linea means line, right? So this is the linea aspera, a lot of muscle attachment here. Then we go down and we can see the condyles, right? The medial and lateral condyles that articulate with the tibia down below. So this is the intercondylar groove, which actually this is not on our list, is it? No, it's not. But intercondylar groove, and then even as much as these are condyles, we also have some muscle and tendinous and ligament attachments here at the lateral epicondyle and the medial epicondyle. So epi means above, right? So the epicondyles are here, and here the condyles that articulate with the tibia are there. The patellar surface. So the patellar surface is on the front side. Let's see if I can get it. Sorry. Rotate this around to the front. Maybe I can't. Here we go. So this is the patellar surface right here. This is where the patella, the kneecap, that that bone that forms via kind of during development, later on in development, that forms in the middle of connective tissue, right? That's the patella, patellar surface that sits right there. Okay, let's do the tibia. So here we have our tibia. This is the right tibia. Whoa. And I know that because I can look for this downward projecting feature here. This is actually kind of wrapping around the tarsal that it articulates with, which is called the talus. So this is wrapping around here, and I know that the fibula is on the outside of this tibia. So if the fibula is on the outside, that means there's no space for, there would be no space for the fibula if this lateral, or if this malleolus were on the same side. So since fibula is on the outside, that's lateral. This must be the medial side, and this is called the um, medial malleolus, right, of the tibia, the medial malleolus. Looking up here, we have the this roughened region here, right? This roughened region right there on the tibia. That's the tibial tuberosity. We turn it, right? It's the tibial tuberosity where you have the insertion of patellar ligament, and a bunch of tendons actually insert on that ligament as well. So it's a big muscle attachment here, the tibial tuberosity. And then these are the articulating surfaces. You can see there that the femur is articulating with the tibia on these surfaces. So we call these the condyles, right? The condylar surface. So this would be the medial and the lateral condyle, medial and lateral, and then just to the outside of those, right, we have our epicondyles. So this is the epicondyle, the medial tibial epicondyle, lateral tibial epicondyle. And those are also two more we didn't have to know. Sorry. And finally, let's do the fibula. The fibula. Oh, this one it's quite dark. The fibula. All we have to worry about with the fibula is the lateral malleolus. So just like we had the medial malleolus, right, in our tibia, we have the lateral malleolus right here, this lateral malleolus in the fibula, right? So I'm going to show you another image of that fibula so you can see that a little more clearly. Okay, so here's our tibia and fibula pair. So we know this is the medial side. This is the medial malleolus of the tibia. Here's the fibula on the lateral side of the tibia, and then that's the lateral malleolus of the fibula. These two malleoli kind of wrap around the top bone here, which is the talus, right? So let's take a look at that really quick. And actually, let's take a look at the back of the tibia fibula as well. So we've got the anterior view. Let's also take a look at a posterior view of these. You can see the articular surfaces here, the condyles. Hopefully you can remember. Now we're looking at the back, the posterior view. So this would still be lateral and medial. So they've kind of flipped sides on us, right? So that would be our lateral and medial condyles. Here we'll just take a look, make sure we see our medial condyle would be there, and our lateral here, and there's our fibula. You can see the fibula, the kind of the head of the fibula kind of fits into a little notch here behind the tibia too. Okay, let's take a look at those bones that articulate, and that would be not the meta. Here we go, the tarsals. Here's our tarsal. So this is looking down from above at a human foot. You can see this is the bone that articulates with the fibula and tibia. This is the talus, and then down here we see this thing sticking out. That's the calcaneus. So I want to show you, so there we've got our talus, our calcaneus, and we don't care about the other ones, right? These are the other talus bones that we're not going to worry about. And then of course these are the metatarsals, just like we had metacarpals, right? Sorry, metacarpals here in our hands. We've got metatarsals here in our feet, and then the distal, the phalanges, right? So just like our thumb, we've only got 2 phalanges here in the big toe, and then these others, right, have 3 phalanges, just like all of our fingers. I want to see if we get another view of that so we can kind of see that from the side. Here is a nice left human foot, right? You can see there's only 2 phalanges here, so that's got to be the big toe. So this is the left foot. Here we got 3 phalanges, so these are the sort of the fingers of the toe. Here are our metatarsals, right? And then here's all of our bones of here are all our tarsal bones, right? These here. But importantly, the ones I really want you to focus on, and the only ones I really ask you to know, is this one here, the talus on top, which you can see has a nice, look at that, articular surface. So it just looks like it kind of sits in the tibia and can kind of rock back and forth, right? So that's what allows us to do this kind of thing with our foot, right? That's all happening right around the tibia and the talus, right? So they're articulating with the tibia there, and of course fibula, but most of that that dorsiflexion is all done against the tibia, and then it articulates with the remainder of the tarsal bones anteriorly, and then inferiorly with the calcaneus, right? So this is the other one that you need to know, the calcaneus, basically the heel bone, right? And so this is that, when you go back and feel your heel, this is what you're feeling. You're feeling that calcaneus, right? So that's our calcaneus, that's our talus. And then we've got our, metatarsals and phalanges here. Okay. That is it. Those are all the bone markings. Please let me know if you have any questions about this, and I will see you again in a future video.